So we have Kerry Forrestal on. He is a MD, of course, and he's also an emergency room doctor. So we're definitely going to bring him on again with all the healthcare crises in our country. If
Yeah.
he's so grateful to come on and talk to us again. But
Oh, absolutely.
yeah, Kerry's working around the clock right now with all kinds of different patients in the ER. But he did publish a book, and it is coming out. It's Crushing Cancer, a patient's complete guide to managing cancer diagnosis. Kerry, this is an important book. I appreciate you coming in. Thanks so much for doing this.
Thanks for having me, man. I greatly appreciate it. I hope you're okay. I came straight from the ER today, so you got me fresh from the fight.
But let's talk about the book, Crushing Cancer. What made you want to write this book in general, Kerry?
Well, there are three reasons that come to mind why an ER doctor writes a book on cancer, right? So first, cancer runs in my family. You know, we don't have heart disease, diabetes, hypertension. We have none of it. I have a 97-year-old father who just got back from Ireland a couple of years ago. So he's doing great. He's got mom with him, but cancer. So my mother's working on her third bout of lung cancer. My father's had skin cancer a couple of times. My grandmother, uterine cancer. My grandfather died of bladder cancer. My cousin right now is unfortunately got a glioma of the brain. So that's something that's very much of interest to me. The second reason is in the ER, we diagnose a lot of it. So we have people who come in, and I can remember one gentleman very clearly. He was in his 70s. He's where we all want to be when we're in our 70s. He's an entrepreneur. He's golfing every day, and he thought he tweaked his shoulder golfing. And when they took the x-ray, there was the lung tumor, right? So he came in for what he thought was going to be a shoulder injury, and we found, unfortunately, lung cancer on the gentleman. And we do a lot of that. You come in for one thing, and we say, yeah, there's this thing you need to go have looked at. And it's always been frustrating just to say, good luck with that. So I wanted to do something that could go outside the walls of the emergency department to help people. And the third thing is, when something goes wrong in a lot of things, you know, the guys who go, hold my beer, you know, and next thing you know, there I am. But when things go wrong in cancer care or any medical care, where do you go? You know, you see a lot of it come in and you go, if you'd only been able to, or if you only had access to, or if you only known, this could have been avoided. So those are my three reasons for having written this book. This is 20 years of experience from the emergency department and 17 years before that in EMS of just things that go wrong during cancer care.
So, you know, I've heard this, and you can correct me if I'm wrong, because we want to always get the facts right on this program, is that we're seeing a lot of cancer in younger people now. And it's not just the skin cancer, because, you know, they talk about the tanning, and I'm against that. You know,
Yeah,
I see
sure.
guys and girls go in and they go into the tanning salons almost every day or once a week, whatever. And we know how bad that is for our
Yeah.
bodies in general, how that can really drum up cancer. But what cancers are you seeing prevalent, you know, more prevalent, I guess, in younger people and more in older people?
I don't know if the rates have increased. A lot of times with the younger kids, we see the blood cancers, the lymphomas, leukemias, those sorts of things. I don't know that the prevalence in younger kids has gone up all that much. You're right, tanning is a terrible thing to do. Smoking rates, you know, they're coming down. My favorite thing to ask people, everybody knows that smoking is bad for you. If you ever really want to do something interesting, don't think about, you know, it's bad for you. Everybody knows that. You're adults, right? Think about the amount of time in your life that you have to give away to pay for your smoking habit. So if you smoke a pack a day, let's say, right? And you make 20 bucks an hour, you're going to work, and there's tax and blah, 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 but you're going to work about 6 weeks. So I really hope you like your job, you know, because you're going to have to work 6 weeks so that you can smoke. But back to your point, I don't know that there's a big uptick. I can certainly look into it for you and get back.
Can you talk about how we manage that cancer diagnosis? Because I'm sure that's a pretty huge deal, is how we pay for this.
So here's the thing that I try to tell people. You give the news, you use that big C word, right? You use that word, it may be cancer. Now, right then and there, people are going to tune out. They're going to go, what? And there's this feeling that my life has ended. I am done. This is how I end. And it's not true. Cancer is not a death sentence. And that's a big theme in the book. Cancer is not a death sentence. It's a fight. And we are better and better and better at winning that fight. If you think, you go back to when my grandfather got bladder cancer in 1970, his chances were terrible. Cancer deaths were the rule, right? Now you look at things like thyroid cancer, 97% cure rate, right? Stage 1 cancers, 70, 80, 90%, right? If early detection. And the whole key to winning that fight and not becoming destitute is to start early and start right. From hour one, day one, we say, is if you manage your fight well, you're going to do better. There's actually research that shows if you run out, and it makes sense, right? If you run out of money, you're not going to have as good an outcome in cancer. If you can't afford the medicine, if you can't afford to get to the doctor, if you can't afford, you're going to do worse. So we have a whole chapter, the longest chapter in the book, actually, chapter 10, is just how to manage your finances. You shouldn't look at the money in your bank account as your main resource. There's so many other things. So that's the first step, is start from day one, hour one. We have spreadsheets, we have checklists, things to basically get you started on how you can manage this and get the best outcome.
You know, what kind of mindset do you talk to the person? You know, when you go up to them and tell them they have cancer, I'm sure some people think they're in la la land, and then they don't really comprehend that kind of diagnosis. How do you kind of frame your words differently, like from somebody that may, come in there with, I don't know, a broken arm, to somebody that you tell them they have cancer? Because this could be like a shock and awe thing for them that they didn't even know about. And that's probably usually the case. You can correct me if I'm wrong.
We tell them, you own it. You say, look, I just used a big word with you, right? That word cancer is one of the biggest words in our language. And some of it's cultural, like in the Middle Eastern cultures, right? I had friends who've helped me with the book. They don't call it cancer. They call it the other disease. They won't name it. It's considered cruel to tell an older person who's from some of the Asian cultures that they have cancer. It's a mean thing to do. In America, with our culture, we're taught as physicians, you lay it out there, you tell people what's going on, but then you absolutely must come right after it with the hopeful part of it, because there's a lot to hope for, right? We've had surgery for hundreds of years. We've had radiation for since the Curies did their thing with radium, right? So that's the 1870s, right? A little bit later. I'm probably wrong on that. You got the mid 1940s, we have chemotherapy, and now we live in an age where immunotherapies are exploding every day. It was one of the hardest things to keep up with the book. Every time I would think I would finish the chapter on immunotherapy, there was something else that should be in there. So it's just every day there's some amazingly smart human being coming up with some other amazing thing, right, to help us beat this disease. There's so much to be hopeful for, but again, it's all you can't. The worst thing you can do is go, I have cancer, shut off and run away from it. Everybody wants to close their eyes when something bad happens, right? If you're in the water, you see the shark, you close your eyes, the shark hopefully goes away, right? But better to swim away from the shark as fast as you can, right? So same thing. If you manage this well, you're going to get a better outcome.
For people that do work out, and people that work out get cancer just as people that don't work out get cancer. So, how would you make sure, is there a plan we should put in place if we do have cancer and we, are athletes or do work out, like to stay in shape, to make sure that we don't, regress? Because you got to keep that movement going, keep those muscles going, even though you're going through this tough time.
Yeah. Oh, working out is one of the best things you can do for your mood. It's a great thing to do for your body. Everything is affected. But here's the thing. You have to know yourself. There is no one size fits all for this. Everybody's a little different. Some people, they drag themselves out and they will work out, but they will do it and hate every step. And other people, they get the runner's high and they run until they get that high, and that's a joyous thing. So know where you sit on that curve, right, on that spectrum, and work with what you want to do. And accept the most important thing, accept that there are going to be good days, there are going to be bad days, right? Maybe the day after, the second day after chemo is going to be a loss. Now, when you're in one of those bad days and you're just laying in bed, you're hating life, what am I doing? Why am I even bothering? Remember, there's going to be a better day, right? This is not how it is. This is how it is for the moment, and you're going to have a better day. And when you have the better days, make sure you make use of them, because you're going to have to go through another round of chemo and you're going to feel like garbage again. So when you have your good days, use them, right? When you have your bad days, don't buy into the idea that this is how it is, and exercise as much as you can, right? Eat the good food, right? Take care of your body, and really just be kind to yourself. You know, that's the biggest thing is be good to yourself.
How do people find the right cancer doctor? That was an audience question I got, and it was, you know, it was kind of reframed in different ways many times.
Yeah.
So how do we do that?
So any cancer doctor who's board certified has a certain set of skills and a certain knowledge base. So I always ask this question: what does a car do for you? Right? Gets you from point A to point B and carries your stuff. What else does a car do for you? Right? Some people it's a status symbol, some people it's this, some people it's what, but really all it does is get you from point A to point B and it carries your stuff. So here's the question: why are there 1,000 different types of car on the market? Right? How many different types of cars are there? Right? A successful cancer partnership, right, is going to be somebody that you connect with. The best cancer doctor is the one that you're going to be willing to follow through this. They all have the requisite skills. They all know the medicines. I mean, they can't get board certified without knowing this stuff, right? Mm-hmm. So if you go to a board certified oncologist, the biggest thing is going to be, you know, where are you comfortable? We live in an area where we have a cancer center here, and it is terrific. It's got great people. I'd let them take care of my family any day of the week. But we're also in the backyard of Hopkins. And of course, when everybody says, oh, I got to go to Hopkins. Well, you know, Hopkins chemotherapeutic agents are the same as our therapeutic agents, right? They're the same thing. You know, so if it makes you feel better to travel the 2 hours and go to talk to somebody who's a Hopkins doctor, they're fabulous. They're great guys. They may not be as good looking as we are, but they're still okay. All right. But point being is that they do a great job and our guys do a great job. Is who you feel comfortable with. That's the best cancer doctor. The other thing that just have to mention here, the partner of the oncologist, of the doctor who's taking care of you, is the nurse navigator. These guys are your Sherpa guides for cancer care. They're the ones who know where everything is. They know, you know, when you need this, that, or the other thing to make sure that you have successful, let's say you're doing home infusions. They know everything that you need to do to make sure that it goes properly, and they know how to troubleshoot it when it doesn't. So like I said, so the cancer doctor is the team leader, but your nurse navigator, you know, the oncology nurses, they're absolutely phenomenal. And know who your nurse navigator is on first name, and make sure you got them on speed dial, because they will save the day any number of times.
What is the most important part of crushing cancer, do you believe, Doc?
Most important part, your attitude.
Mm-hmm.
I think more than anything else, believing that you can get to a cure is the first step. Because if you go, oh, it's lost, then you're not going to run the race like you should. You got to, it's not going to just come out of nowhere. Reading my book, I would hope you read my book, you put it down and go, I'm ready to go, let's fight. And that's why I wrote it the way I wrote it. But it comes to some people quickly. It comes to some people slowly. We do have people who get a cancer diagnosis and they're like, that's fine. You know, we had one guy who I remember early when I came out to Maryland here. I had one guy who had walked away from, you know, we told him he had lung cancer, and he said, okay, well, that's fine. We said, well, we got to get you in treatment. He's like, no, I'm not doing that. I'm just going to live my life, and that's fine. And, you know, usually you go, okay, I'm going to wait until you chicken out and come and want to get care. But he didn't. He came back like a year later, and he was on death's door. And he wasn't like, oh, you got to help me now. He was like, this was a choice, and I'm happy, just get me through till my sons get in town and I can say goodbye, which we did. And he passed on his terms. And all of those things are okay. There is none of that that's wrong. So it's your attitude and how you fight it, you know, and then just you got to have hope that you can have a good outcome and just move the next step.
Since you brought up lung cancer, I want to bring this up because I'm hearing this a lot. We hear a lot of people that don't smoke are getting lung cancer now. What is all that about?
So certainly secondhand smoke doesn't help at all.
Right, true.
Cancers of the lungs, the biggest provoking agent is the smoke. But there are other things. You take guys who are, let's say, arc welders,
Yeah.
and they don't wear the mask and they get those things. Remember, cancer is multiple diseases that are characterized by uncontrolled growth, right? That's what cancer is. It's cells that just all of a sudden go, I'm not going to stop growing. So the example I use is this. Take your hands, put them together like this, okay? Why are they the same size, right? Why are those things the same size? Why are they not? Why isn't it longer like this, right? There is a stop message in every cell that you have, which is why we don't grow to 9, 12, 92 feet tall, right? So I'm 5'9", that's it, I'm done, right? I'm never going to get to 5'10", right? Now, I can get bigger, right? If I, shop in the middle of the store like we talked about, and there are the ding dongs and yodels and ho-hos, and I eat them, I can get wider, right? Because I have the ability to store fat, right? But I'm not going to get taller from doing that. When that mechanism to stop growing breaks, there's actually a backup system. So that has to break too. And when that happens, you get cancer.
Yeah.
That will make sense. I think I lost your original question and all that. So but you're saying about lung cancer. So you can get lung cancers without our commonly accepted provoking agent of tobacco. And we don't know what the vaping is doing yet. We're still learning that. It's not as safe as everybody's trying to pretend it is, but I don't know how dangerous it is. We're learning that one.
Yeah. I was told that some of the stuff is environmental too. I agree with you that it is, but if you live like near a smokestack,
sure, environmental pollution, sure,
yeah,
absolutely.
okay.
These things can do it too. Have you ever heard of the thing called there's a thing called the stress diathesis model, which basically means you have to have the predisposition to have a problem, and then you have to have a spark. So it's like kindling and a match, right? So if you have the predisposition to have cancers like we do in my family, and then you get that exposure to tobacco, for example, you're going to tend to get lung cancer like my mother did. She smoked for 30 years before she quit. And she's working on her third bout. It's tiny. She's going to survive it. But, that's her third go around with lung cancer. She lost part of her lung to it the first time, radiation the second, and they're going to do radiation the third.
You kind of gave this answer earlier, but I'm going to see if it's a little bit different with this question. What do you hope that people get out of this book?
I hope this gives them the game plan to run their cancer fight successfully. And I hope more than anything else, it gives them the hope to fight. You'll find it somewhere. You will. And I hope you find it in this book. A dear friend of mine, a guy named Steve, his mother-in-law, he's newly married. His mother-in-law came up with lymphoma. And they were like, oh, well, you don't know what to do at first. It's always hard to know what to say to somebody who's like, yeah, I got cancer. And it can be awkward and people say dumb things sometimes and all like that. But we want to do something. We want to act to help our loved ones when they have cancer. And their thing was to give the book to her. Yeah. Right. So she read it, and they said it took her from a place of being very depressed and very negative about the future to saying, all right, we can do this. This is the game book. This is the game plan. This is how we kick this thing's butt. And she is doing great. And it isn't my book that cured her cancer. It's the amazing guys down at MD Anderson. But she's running around MD Anderson right now, this little old lady whacking oncologists over the head with the book saying, you got to read this, because it should and does give people hope. It's written with humor, which everybody goes, wait, you wrote a cancer book and you're making jokes? But if we're not going to live life and laugh and enjoy our lives, what are we fighting for if not to continue to live and laugh and love?
This is Dr. Kerry Forrestal here on Fire Breathing Rob. Definitely check out the book, Crushing Cancer. As we go toward the end of the interview, Doc, where can people find more about you? Obviously, they can get the book at Amazon, Barnes and Nobles, your local bookstore in general. But where can they find more about you and learn more about you?
Well, I don't think there's any repository of Forrestal knowledge just yet. We're planning a library and a monument. But the book is on Amazon. My other book, I wrote a science fiction book called Miss Clipper Chicane with a good friend of mine, which if you like science fiction and genre blending, I'll tell you, man, we've got robots and vampires and ships that float on mist. And it is a smorgasbord of science fiction. And the other is that we wrote a play called Club Hell, which is about two marketers who wind up in the afterlife and they try to con their way out of hell by convincing the devil he needs a new marketing image. So hey, look up any of those things and you'll get to know me through that.
So my last question is, I was going to end there, but my last question is, where are you finding time to write all these books and plays when you're running around like crazy in the ER?
Like I said, attention deficit can be a wonderful thing. So like I said, it's, you do a little this, a little that, and all of a sudden you go, oh yeah, that's almost a book. I'll do that. So yeah, it's, I'll send you something that I'm a woodworker too. And I built my kids a bi-level treehouse. And I'll have to send you the picture. I'll send it to you and you can put it in the show notes if you like, but yeah. So, but these things we do to help us decompress from the emergency department. There's nothing better than to get lost in a world of your creation, like with the Miss Clipper Chicane that I wrote with John Frasha. It just relaxes you. Or when you woodwork, as long as you keep all your fingers, it relaxes you. Writing a play is wonderful, and all of these things. I'm a terrible writer. My editors hate what I write, like, oh God, but for people who are listening to your podcast, just go try and do new things. I never wrote a play. I never wrote a science fiction book. This was probably because the first book went so well. I've never built a treehouse. Just go do things, live this life.
What made you want to become a doctor?
Oh, well, when I was 16 years old, I had my mother I was telling you about, actually, she was a bit of a pioneer. So we had in our hometown what was called the American Legion Ambulance. All these guys from World War II were bringing the veterans back and forth. The World War I vets back then, believe it or not. I've met World War I vets and all that. Wow. So they were bringing these guys back and forth to the hospital and then back home. And it evolved into this ambulance. Now it was a very modest arrangement. It was 3 ambulances and the women were supposed to stay at home and watch after the kids, but they got onto the ambulances. So my mom was actually an ambulance driver back in 1970s, right? And they needed some lift helping and I wanted to, it looked cool. They would run out in the middle of the night. It just looked cool to me. So on December 24th, 1979, I ran my first ambulance call and it was a drunk guy, and I'm sitting there, I'm 16 years old and there's this guy, wow. He's having a stroke. He's drunk as all could be. He's huge. He's a mountain of a guy. And I'm sitting there, I'm just wide-eyed looking like, oh, this is really happening. And he grabs me by the throat and he tries to pull me in and punch me, right? And the cop, takes him off me and puts me against the wall. He goes, look, if you can't be helpful, just don't get in the way, right? So they send us away and we get called back about a half an hour later. And now the guy is unconscious. So we load him up into the ambulance. It was a trailer. So we had to take the doors off and there's a dog barking. And right as we get into the ambulance, we get a call for another guy. Right now, this is now morning of Christmas morning, right? So it's December 25th, now 1 a.m. And this guy put his family through the windshield of a car drinking and driving. So his face is just absolutely shredded. And I'm up there, well, the medics are working, EMTs, we were basic. And I've got this guy here who's hemorrhaging and he's done everything that you don't want to smell. And this guy is all shredded. Now you either love that or you hate that and you never do it again. And I just couldn't get enough. So I was a medic from 16. I got my EMT at 18. And I ran on the ambulances for 17 years until I went to medical school to get the big box of crayons is what I said. And emergency medicine was all it was ever. The only thing that came close to pulling me away from it was I just loved pediatric critical care and oncology. Those were the two things that almost took me away from emergency medicine, but I figured I'm going to get enough of that in emergency medicine, and surely I do. So yeah, it was a wild night. So life-changing night.
I got to follow up with this then. How do you detox from the insanity, like you said, for all those years, 17 years in the EMS, and then you go into the ER, you see all kinds of sick things, crazy things, COVID, drunk driving. cancer, everything in the kitchen sinks. How do you detox? Because I'm thinking of, these warriors that fight for the country, and they are, having all these
Yeah,
issues with
horrible. Yeah.
PTSD.
Yes.
And
Yeah.
I'm worried about, how do you guys not get that kind of PTSD from
Some
working
do.
on, yeah.
Yeah. Some people do. We just recently had a suicide on staff.
Oh, geez.
We do have some people find their inner rhythm, where
Mhm.
they can leave it at the door. I have one of our docs is like, you have to swipe your badge to get out, and he says that's a memory wipe. He just leaves it all behind. The thing in emergency medicine, the first most important thing to remember is that unless you're the person laying on the gurney bleeding or having a heart attack or whatever, you don't have a problem. You have a job to do. And God knows residency. I mean, 20,000 hours of people really just working over. I did my residency at Jefferson. I did my undergraduate at the medical school at Stony Brook. Fabulous institutions, and they prepare you just unbelievably well to go out and do it. So when you're presented with these things, you have a fabulous team. You've got the resources to do it. You get the skills to do it. It's okay. And there are bad things that we see. They're certainly true. But then you think about, I've got a great family. I've got a wife, Shannon. I've got 2 fantastic daughters. I've got a dog. If you want, we'll talk. But like I said, it's great. And then you do things like write, like woodwork, play guitar, those sorts of things. And you just, you leave it behind as best you can. There's stuff that stays with you. It always will. But, the more of it you can leave behind, the better you do. And that's not, I don't say that should be how everybody is. Again, everybody's an individual. That works for me.